I actually came here from North Carolina, and when I finished my training, one of the things that was very important to me was to be able to go to a group or an institute that had world-class care, but also, more importantly, had the things you need to do in order to get world-class care. Many groups really care about patients, but one thing I really loved about this group in particular was all the technology, the clinical research trials, and more importantly, the staff that all helps everybody work together. Coming from a large institute, I was used to having what I thought was the best of the best. And many smaller groups did not have this, and neither did a lot of the hospitals. So I really was particular in looking for groups that had everything that I think I need in order to give the best care that I can administer. And so when I looked at groups in North Carolina and Tennessee, Florida, and even Virginia. And when I came here, I was just overwhelmed by everything that they had here for the patients. When patients come to Highlands Oncology, I think they can expect a lot of different things. You know, each patient, I'm sure, has a fear when you come in here. And one thing we hope that we do is treat patients with compassion, try to help them overcome their fears, and try to treat them as humanely as we possibly can. I wish we could say that we cured all patients with cancer, but we cannot. But what I can guarantee is we will treat everybody to the best of our ability. Sometimes treating you means we do not give chemotherapy, but instead just focus on treating the symptoms. Other times it does mean giving standard chemotherapy. But also what I really enjoy about Highlands Oncology is we are able to give the best care and the newest medicines available. Through many of the research trials, we are able to help prolong lives. When patients have just been diagnosed with cancer, they have a variety of things that run through their mind. One, you know, can you cure me? Two, will I be in pain? And what can you offer me that's not standard? One research trial that was done here was nationally published in the New England Journal of Medicine. And this was just the biggest breakthrough in breast cancer in the last 5 years. And I'm proud that we were able to have patients on this because that means we were able to help them. You know, oddly enough, I think the most rewarding part of my career is the patients. You know, people have asked me before, why do you do what you do? And I really say it's the patients. You make such a bond with patients when they're going through a ordeal, and being told you have cancer is one of the, I think, the hardest things that you can tell somebody, that you have a cancer that could be incurable. But I think when you show them that you care, you create a bond, and it's that bond that brings me to work every day.